Hello, my lovelies. My name is Lecka, and today we are going to be watching Season 1, Episode 2 of Botched, titled Janice Dickinson Knows Breast. If you guys missed the last episode of Botched that we watched and reacted to, then go ahead and click on the eye icon here in the top right-hand corner of the video, and it'll take you straight back to the first episode, so you will not be missing a thing. But if you are already, tucked away and ready to go for this one, then we will be having a very good time. Make sure that you guys go ahead and like the video ahead of time because this is going to be a very fun adventure. And subscribe if you have not already because it is a freaking, fracking, wonderful, and free way to help support the channel too. But for now, let's go ahead and watch episode 2 of Botched.
Do you know who Janice Dickinson is?
Of course.
I'm sober.
You don't take any narcotics?
Well, I'm gonna have to take narcotics for this.
I'm not sure how we're gonna get control of her pain post-operative.
Who took your dressing off?
Drug
I did.
What is this?
addiction is
The
really
drain
hard.
from my boobs.
You took your
Especially
drain
for
out?
surgery.
Kill me.
You're gonna this up.
My nose is actually more crooked now than it was prior to that procedure.
Your septum
Wow,
to
that is
more-
so crooked.
That is so crooked.
How did we miss it?
You had westernization of the upper eyelid.
Now I look like monkey's butt.
It would take
Oh, geez.
very little to make it so you could never close your eyes again.
Every year,
Well,
over
that's
15
terrifying.
million people get plastic surgery in pursuit
We're gonna
of
skip
perfection.
the,
I had a facelift.
Cheap
the intro here.
I'm Janice Dickinson. I am the world's first supermodel.
I don't know about
French Vogue,
first
Italian
supermodel.
Vogue, Mexican Vogue, Vogue. You name it, I've been on the cover of every magazine in every world for every season. I am no stranger to plastic surgery. I've had a facelift, a brow lift, tummy tuck, and fillers. I'm perfect, except for my
Except
when
for
I
your
was
tits,
waiting
huh?
as a supermodel. I had very small A's.
Those
and
are tiny.
Designers love that. I was 32 when I had my first implants. They didn't feel like breasts. They felt wooden. One went in one direction and one went in the other direction. But I was happy because my breasts finally fit into a brassiere. I wanted to have softer breasts, so I went from saline to silicone. Sylvester Stallone paid for those, so I figured, why not? Free I'm in. After the second surgery,
So she is a very strong personality, as we can already tell, but I can see that she is the interesting portion of the episode. If you guys don't know the formula of botched episodes, it's always somebody that usually, except in this case, 99% of the time gets denied surgery but is brought on because of their extreme nature in plastic surgery. For this one, they're going to do surgery on Janice, but they are having the story be about her because her life is very interesting as being a supermodel. I don't know about the world's first supermodel, but being a supermodel in the past, which is still a very, very, very big achievement to have under your name whatsoever. But we do have the other two people that are going to be brought in, the eyelid surgery gal and the nose surgery guy, and we can, watch a little bit of their stories too, but the main focus of this one is going to be on her. Now, with the intro that we saw, she is going to be having a struggle with narcotics, which if you've had an opioid addiction or any kind of painkiller addiction, muscle relaxer, addiction, especially going into surgery, you can't not have pain meds after surgery because it is an extremely painful recovery process, and you need to get ahead of the pain, is what it's called, and take your drugs on time so that you are in as little pain as possible, and then you can wean off of them in the days after surgery once your body is healing and getting more used to it and you don't have to take as much, but you need to take it on the dot when the doctor tells you to take them for the amount of time they tell you to get ahead of the pain and make sure that you're comfortable so that you're not completely hating your life while you're in recovery. So I think that's going to be a major problem for Janice here while we watch her shenanigans. And her breasts do look, just based on what she has here, lopsided. One is bigger than the other one. Her left breast is lower than the other one. Her right breast is higher than the left, but it's also shaped interesting here. You can see that it's, instead of being round like her left one, it goes to almost a point and then just has a sharp side going up, which is a little odd. So I'm not sure what the issue is. Maybe there's like a lot of scar tissue that's caused the shape to be that way. Oh, hi, Pocky. Welcome to the video. Guys, this is my kitty cat Pocky. He's my little old man. He'll be joining for probably most of the recording. But anyway, I'm curious to see what the issues is because I don't remember from seeing this in the past.
they started to get ridges. It was like canyon ripples. I did
Yeah, there was a
American
lot
Idol.
of rippling on her.
And I wore something extremely low cut. And
Oh,
I
you
got
can see the
dogged
ripples.
The next day globally because they zoomed in on my breast and you saw the ridges and the ripples.
Yep.
I should have worn a wetsuit. Hi.
Hi. Hi.
I'm Janice Dickinson.
Amanda.
How do you do?
Good. Nice to meet
My
you.
friend Steven.
Hi.
Hello, very nice to meet you. How you doing?
We
She
have
does look
several
extremely well dressed,
outfits that
though.
we
Her
need
outfit
for
is
Fashion Week in
adorable.
New York, Fashion Week in Paris. But the thing of it is that I have tricky breasts. When I stand in front of
Okay.
the mirror naked, I always see the ridges.
We have full racks here for you.
I'm gonna have a full rack after I get my boobies done. The red carpet is the red carpet.
Ooh, I
People
loved her
critique it,
lipstick. That was a
They write
really
about it in
pretty
fashion
color.
magazines. They talk about it on Fashion Police. They talk about it everywhere. Oh my God, it's Versace. I was the original model when Johnny Versace first designed the metal dress back in 1978.
Oh my gosh, that's
I
amazing.
know, I love Versace. May he rest in peace. I
A
don't
metal
want rock
dress?
stars. I wanted them
Sounds
to
cold.
look appropriate for a woman my age.
I'm just like
No, I know, but I can't walk around and hold my breast like that all day long.
No.
Hopefully, with the help of Dr. Dubrow, I
That
can
is really
have
pretty,
my
but
wishes and
it's
dreams
so
come true.
wide, your
Because
nipples
if
are
he
gonna
does-
pop out.
oh, his-
Jesus. All right, well, apparently she's gonna suck his. So that's exciting.
This is something a little bit different. Do you know who Janice Dickinson is?
Of course.
First supermodel?
Yeah, and she's already actually had a good amount of work done. Well,
Hi, I'm
hello.
Janice.
Wow.
Janice,
She's also
do you which is which?
extremely fit,
Pleasure.
which
How are
she
you?
looks
Dr. Nassif.
amazing.
Nice to meet you.
Pleasure.
Dr. Nassif.
Heard so many great things about you guys.
Really? I'd like to hear
Yes.
that. Please have a seat.
Yay. Hopefully, you can help me with my breast.
I think they
What bothers
can.
you most about your breasts?
My silicone breasts have been in there for about 30 years. Yes.
When you get your breasts
30
done, you're really supposed
years.
to have them replaced every sort of 10 to 15 years. Implants that are more than 13 years old have an 83% chance of being ruptured. These implants being from the 70s, who knows? We may take them out, put them on there, there might be streaks of cane still left on them.
I feel
Jesus
like
Christ.
there
Okay,
are
I don't know about all of that. He's trying to be dramatic for television. But the fact that she has had the same implants in for 30 years and has never gotten them changed, the problem with that is exactly what Dr. Dubrow just said. You can have a significantly higher chance of them rupturing and causing more havoc in your body because of the rupture. Not only will it destroy the shape and symmetry of the breast if you had any beforehand, can have the silicone, if it ruptures, potentially move itself to other parts of your body, get lodged into lymph nodes, cause health issues and problems. It's very, very unsafe to keep them in for that long. Like for the implants that I have in for my breast right now, they are only going to last for, like you said, 10, 15 years. And you want to do it on the lower end if you can afford to go back and get them replaced. That's why eventually when I get mine done, I'm going to just have the implants taken out and I'm going to have them just use the massive amounts of natural breast tissue that I have to give me like a C or a D cup that is super perky and just stuck on with like a very plastic doll bimbo-like look, right? But she wants very soft, natural breasts because she's trying to look more natural. That's the look she's going for. Very soft, but still voluminous, still round in nature, but low enough that it's a more natural position rather than higher up. And like she's described before, it felt like wood to her when they were too high and just too stuck on. She wasn't going for that look. Because these are reconstruction surgeries, I think they'll be able to give her that look, but whether or not she's going to be able to do the aftercare to have the surgery come out properly and actually turn out good is a different story.
Articles that are rolling around like the size of edamame.
The good news is you've done the
Edamame?
old-fashioned
It's
one, which is to
edamame.
put those old,
Shannon.
Stop saying old.
Or Janice.
those
Antiquated or anything.
antiquated. You had
Antiquated.
the
Okay, so she
other
doesn't
silicone
know
implants
a lot
put
of
on top
vocabulary
muscle.
very
That was
well.
the that was the other way that was done.
Interesting.
Previously. Theoretically, we would take those implants out and then lift up your pectoralis major muscle, peeling it off the ribs,
That would be a painful recovery.
and then lining the inside of the breast pocket with them so that the new implants go under the muscle.
Well, I'll be under anesthesia, right?
Yeah.
I don't take narcotics, but
You don't take any narcotics.
well, I'm gonna have to take narcotics for this, but you know, I'm sober. I have had drug and alcohol issues in the past. I'm nervous about doing this operation sober without taking pills to calm my nerves and my anxiety. So there's like, you know, I'll go to a
I mean, that's
recovery
a big
center
one.
and that'll be good.
It'll be good.
We'll just work within my program of finding the easiest, softest way we can go through this operation.
Okay. Let me ask you a serious question. Do you have any supermodel friends for Paul?
Yes, we do.
I'm not looking for
Do you have any
I
supermodels
can
this
help.
woman knows?
Let's do that stuff later on.
We
Jesus
hook you up,
Christ.
You'll hook him up?
I'm doing fine.
We know plenty of available women. Too bad I'm engaged, otherwise I would have hit on you.
Well, then he
But I'm
couldn't.
not.
But then he couldn't operate on you. I do think Paul could date a model, but if she could see, hear, smell, or has any kind of reasonable personality, I doubt it.
I've dated numerous models.
Let's go in the other room.
He always shits on Paul, and I'm not a huge fan of it. I understand it's just like their friendship dynamic of them just ribbing on each other, and they have a really good friendship. I just am not a huge fan of giving each other constant shit. Like, you give each other shit every once in a while, but doing it all the time nonstop gets old after a while. But the fact that Janice, has had drug and alcohol problems in the past, and she admits it and knows that she has a problem is a huge, huge step, because that means that she knows her triggers, she knows her limitations, and she is sober right now, which is amazing, and has gotten off of the addiction issues and paths that she's been on before. So how she's going to navigate this, especially with her anxiety, she's going to have to learn how to feel emotions and work through her emotions without drugs, which is something that is very hard to do if you've been reliant on drugs and or alcohol for basically regulating your mood and suppressing your feelings for a long time. So I'm curious to see her emotional process through this as well.
Okay. Hi.
Uh-oh, she's in the right gown there. Perfect.
Okay, so show us what's going on.
See
Okay.
the ripples?
Yeah,
See the ridges?
you can see all
This
the
is the
ripples on
actual
it.
implant. As you know, these are the ridges in the implant.
Really?
Yeah.
So the skin's getting a little thin.
The skin is getting very thin.
My skin's thin.
And your implants are almost touching in the middle. Janice's breasts have a
That's
lot
true.
of problems. She's been in need of breast surgery for probably 2 decades now. The implant pockets are sharing a space, and you have what's called symastia or called bread loafing, where it's like a bread loaf in the center.
Like
Yeah.
you feel like deposits floating around. There's like an edamame.
It's edamame.
Edamame. Let me tell you
Edamame!
what the options are. Ready?
Delicious,
Number
by
one,
the way.
we can take cadaver skin and sew the inside.
No cadaver skin. No dead bones of ghosts. No serial killer ladies that have been in jail. No.
The other option is to make the incisions underneath the areola, the way you have those.
Yeah.
Okay, go the same opening.
She also has really
Take the
small
implants out.
areolas.
Lift up the
Very,
muscle
very
on
small.
each side. Extremely painful.
won't do
Elephant
it.
on your chest kind of recovery.
I don't want an elephant on my chest.
I know, but that's
Why
what it's
do I
going to
have
feel
be
like.
that?
She's had some problems that she admits to with narcotics in the past, so I'm not sure how we're going to get control of her pain post-operatively.
That is
Putting
fair.
The implants under the muscle will do 2 great things for us. One, it should get rid of, if not all, most of the rippling. Number one. Number two,
That it will,
it'll
because it won't be on the
separate
surface.
mounds and stop you from having that symastia, that bread loafing. The question for Janice will be, can I fit the same size implants under her muscle? And she wakes up with smaller breasts with a more normal breast shape. Is she going to be happy? Only time will tell. This is the
That
operation.
is true. It's depending on that as well, because if she wants it under the muscle, she wants the rippling to go away so that her thinner skin is not able to show any ridges or anything, and it's under the muscle so it has another layer of protection to get that more natural breast shape that, like he said. I don't know. I think she's gotten really used to the size of boobs that she has right now, and that wouldn't work out very well for her. But I also like the fact that they are upfront and honest about what the pain is going to be like, about what the recovery is going to be like, because it allays any unrealistic expectations that the patients might have coming into this of, oh, it's going to be super easy. The recovery is going to be fine. I can just have the perfect boobs that I want in the perfect position that I want. It's going to go absolutely amazing. I'm going to have very little pain, and I don't have to follow post-care instructions, and it's going to be exactly the way I want it, because you need to bring them down to a reality check, because it will always be better, but it will never be exactly what you want perfect. It's just going to be as close to what you want as possible is the goal you're trying to get, but it's never going to be exactly what you want. So they need to kind of taper their expectations to be more realistic. So the fact that they're so open about it is something that is really, really good.
of choice.
Sounds like a plan.
These implants are, forgive me,
Don't say old.
ancient.
Ancient!
Them out.
You need them out.
Oh, absolutely, she does.
My name is Cheryl. I
Hi,
was
Cheryl.
born in China. I was abandoned
Aw.
when I was 3 or 4 years old. I always had this insecurity issue because abandonment makes you feel like you're not wanted no matter where you go. I was
Well, yeah.
13 years old. When I came to the United States, I was intrigued by the fact that everybody seems so rich. Well, maybe because I was poor. The
I mean, that's
beauty
fair.
of the magazines, like you're so obsessed with all these images, and you go, oh, I want to be like that. I got to be something that's totally different. I was about 19 years old when I had my eyes done to look more Caucasian by removing the fat on top and the bottom and creating folds on my eyelids so they could be big and wide. Bring it back.
I mean, her eyelids do look
Yeah.
really good. So, like, I know that she's a little older now. If we go back and you can see that they did remove the very typical, more Asian fat deposits that are on the top for the hooded eye that most people do. She now has a more Caucasian one where you can just see the lid and there's just one crease, and then there's the skin between that crease and your eyebrow that is typically more Caucasian, right? Versus having the double eye or extra fat in your upper eyelid that goes down on top of it. So you kind of have like a double eyelid. So it's just a different shape for the eye. There's nothing worse about it. There's nothing wrong with having hooded eyes at all. In fact, a lot of people have beautiful makeup aesthetics that you can only do if you have hooded eyes. And It's just something that, like she was talking about with her childhood, she wanted changed because she wanted to be more like a Western typical look because she idealized them when she came over to America. That is really sad that she was abandoned when she was a child because she was in China and a woman, which is really unfortunate because I know a lot of girls who get born in China get put up for adoption if they find out the sex ahead of time, because with the one child rule that they have in China, which I think they've revoked now, but I remember that it probably is still a very big stigma in China, at least at the moment, where even if they have revoked the one child rule, there used to be one in pretty recent time that made it so you can only have one kid ever in China because of the overpopulation issue, because they have over 1 billion people living in their country. And if you had a girl, you couldn't give up the girl and have a boy because the boy was more sought after as the sex. Girls were looked down upon as not being as smart, not being as valuable. It's not as good of a status symbol to have. Women are really only there to just be the homemakers and be baby makers, and that's it. They have a much lower view of women in China. So the fact that she is one of the people that was a part of that is really sad and upsetting because it just is not fun to know that you were given up and abandoned, because that is true for anybody that is going through adoption or was put up for adoption. The insecurity issues you have, the trust issues you develop, any of those things, because you know that you were given up, and you may not know exactly why you were given up, but you know that you were not wanted, and that can really f with you psychologically. So it's very interesting to hear about her life, but also really sad. A lot of insight into that. I hope that China has repealed the one-child rule. If you guys know more about that, please let me know in the comments down below. It's just a very interesting difference for what happened to Cheryl here. But let's continue seeing what's been going on with her eyes now that she's gotten this westernization surgery.
Done to look more Caucasian by removing the fat on top and the bottom and creating folds on my eyelids so they could be big and wide.
Bring a basket.
I'll get the basket.
Yeah. You're my henchman now, don't you forget. You want to learn Chinese?
Yeah, she'll teach me Chinese.
鲜圆. Taste.
Let me taste one.
It's scallops.
Scallops.
One day,
Yum.
I thought, well, gee, people are not buying the that I'm telling them that I'm European. It's clear as daylight to leave all my Chinese roots behind. It was kind of wishful thinking.
Oh.
You can never, ever change who you are.
Jellyfish 就是海蜇头啊，要折头这个样子。
海蜇头跟这里是海鲜部。
海鲜部，但是我没看到哎。
I freaking just want my eyes back.
Oh. So that's something too with Cheryl's story here. She really wanted to completely get rid of her, like she said, Chinese roots and just pretend that she was European, but you can't change your ethnicity. You can't change your skin tone. You can't change where you came from, right? That's always going to be a part of who you are. She can't, no amount of surgery is going to be able to turn her from Chinese into European, because that's just not how she was born. But that doesn't mean that she still can't be happy. It doesn't mean she can't have breast surgery to make herself happier with her breasts. It doesn't mean she can't have plastic surgery if she wanted it to make herself more happy with her face. But you have to understand the foundation you're working with. You have to understand the ethnicity you are so that you can then figure out what is going to be best for you to be the most aesthetically pleasing for what you're wanting to achieve. If you're trying to just completely change your race, you're going to fuck up your face. You're going to fuck up everything with your body that you're trying to do, because you're going against the natural and genetic foundation and anatomy that you have, right? You want to work with what you've been born with to give yourself the best and enhanced look possible that you're going for, rather than trying to change the foundation. Plastic surgery is there to enhance and get more towards the vision that you want, but it can't change your entire everything to be a completely new slate. It's not a magic bullet. It's an enhancement, but it's not clean slate, if that makes sense. So she sounds like she was never given those reality checks before she went into surgery, that this is not going to be what makes you, European. And so now she's regretting it. Why, hello, Paki. I love you, my little old man. Hello, say hello to everybody. Oh, Paki.
You're getting caught. You're getting fixed.
To be honest with you guys, I'm really nervous about it. He said under the muscle. That would be like lifting up your balls and sticking something inside and then sewing your balls back on. This
I don't think that's the same literally at all.
I'm having an operation without meting myself out because I'm sober. Before, I took anti-anxiety pills like crazy and nothing affected me.
But you're going to be fine. You're going to take the meds as prescribed.
I know, exactly.
But as prescribed.
Right.
No.
No, I don't do that because Rocky won't let me.
Which is
Speaking of
good.
devil,
Tony, how are
hello,
you?
Angel.
Mwah. Lovely to see you,
Rocky, Janice's fiance.
I will. Now you have lipstick everywhere.
You work
Sit
too
down.
hard. Your girl's been very nervous all day. We're trying to calm her down.
I'm feeling sober feelings as opposed to
Normal feelings.
pop the pills.
Normal anxiety.
Normal anxiety, doctor.
It'll be okay. I'll be right there. I was really glad to hear that Janice was
I wonder if he's a
conscious
doctor. I
because
wonder
she
who
was
her
sober
fiance is.
And could feel her real feelings.
It's about growing gracefully. Make them healthy and beautiful
Yes.
and perfect.
The gays love my breasts.
True. That's personality, honey. That's not breasts.
And it's the fact
The
that you
gays
have
love my breasts.
It's interesting.
Steven,
Yes.
I'm giving you the old implant.
Well, I'm going to put them on eBay.
I love Janice the way she is. I could see she's been bothered. I really am looking forward to her feeling more comfortable with her appearance and her body.
I would
No
put them
one
on
hires me
eBay.
again.
Somebody
Of
would
course
buy
he
them.
will.
What if Rocky won't love me anymore?
Of course he will.
What if the dog won't play ball with me?
Ah, the dog's so
right
cute.
now.
But it's good that she's feeling these
My name's
feelings
Paul
versus
Levin.
ignoring them.
I had my nose broken probably at least twice growing up. It was slightly askew to the left, but more than anything, it just had a big bump on it.
Okay.
After a few years of living in
Ooh,
LA,
that
and
is
knowing
super
a lot
crooked.
of people getting nose jobs, I thought to myself, maybe I'll just get it worked on finally and just get the bump removed.
his
if I
nostrils
can,
are
and
so
that way I'll be kind
small.
of back to normal. Finally decided to go ahead and have a procedure done. I knew right away that something was wrong. The surgeon and his assistant removed my cast, and I think both of the reactions were like, huh. You kind of don't want a reaction when somebody takes a cast off your face.
It's shifted
So after
to the
procedure,
left.
I was left with a crooked nose. If I could go back in time, I
Oh,
would have
that's
gotten it.
terrible.
Because the biggest problem with my nose at this point would be my migraines, because they're just so debilitating and painful. It affects everything from my working to my being a dad, just everything. Wouldn't that be amazing if
Oh,
Daddy had no
no.
more headaches and he wasn't such a lame-o?
Oh no, you're never lame.
Wouldn't that be awesome?
I'm pregnant. Paul is the best dad to Olivia, and I have no doubt he's gonna be even better with 2 babies.
I feel like for her sake and for her brother or sister's sake, I need to do this in order to even be the father I want to be.
Migraines are literally maybe 2 or 3 times a week. He can't sleep because he's not sleeping. He doesn't have a whole lot of energy in the day. It's just really hard for us to keep up when he's got the migraines.
It's tough thinking about going into surgery now being a dad.
Yeah.
Whereas before when I did it, it's one of those things that's like, yeah, knock me out, let's do this. Like, who cares? But now I think about, God forbid something happens to me or anything. I want to be able to just like have fun with them and keep up with them. And I can't do that when I'm in pain all the time.
That's true.
She's not going to be this little girl in my house forever. So I want to enjoy it, and I want to be able to play with her and do sing-alongs with her and dance with her. And I feel like a lot of times when I have these headaches, I just can't do it. I just want to.
That's true. He can't. So just like for a minute, because I wanted to touch on a couple things that he was saying. The fact that he is getting migraines, debilitating migraines from the fact that he's had fucked up nasal surgery is wild, because not only is it cosmetically skewed, right? It's very, very easily to the left. He probably has trouble breathing because of how small his nostrils are, so he can't get a lot of air intake into his, system anyway because of the limitation from the size of the nostrils for that. But the fact that he's getting actual pain and migraines 2 to 3 times a week or more from this is horrible. I used to have migraines every single day from the moment I woke up to the moment I went to bed, and for like 16 hours a day. And it was hard to even be a human. And the fact that has a child with another child on the way, and he wants to be able to be a father. Of course, he works to be able to afford this surgery. So he's trying to, do whatever his day job is. He's trying to be a dad. He wants to just have enough energy and be able to breathe well enough that he can just feel good and have something that's more cosmetically straight and something that's more in line with what he's always wanted it to look like on the outside, in addition to getting rid of the pain, would be life-changing for him and the goals that he wants to do. He just wants to be a good dad. And you can see that his child really fucking loves him, that his wife is absolutely in love with him, that he is really a family man. And so this would be a huge benefit to getting it reconstructed and getting the good surgery for him.
Normal nose and not have headaches.
Yeah, not have headaches. Totally get that. Oh, it's a puppy!
Hello, Dr. Nassif and Dr. Dubrow. Here's Paul.
Thank you,
I have 4 cats and no puppy. Eventually I'll have a puppy.
Pleasure.
Though.
Nice to meet you.
Just not in an apartment.
My first impression of Paul Levin's nose, it was pretty crooked.
Oh, it's
The
pretty
weird thing
bad.
is that after I went in for my procedure in 2008, my nose is actually more crooked now than it was prior to that procedure.
So the
Ooh.
surgery made your nose more crooked.
Correct. Most of the time, I'm breathing only through one side at a time.
Again,
This
because of the
one
nostrils.
is the one that always leads me to having these giant headaches that I'm suffering from.
So you think the breathing problem causes the headaches?
Correct.
How many do you have a month?
Oh, I have 2 to 3 a week.
Wow.
Let's go to my exam room,
Significant.
Okay.
and we'll take a quick peek, and then we'll see what's going on with your nose.
All right. Sounds good.
Paul's a really handsome guy. The problem is his nose is completely on the other side of his face.
Well,
Let's
yeah,
take a peek
it's
inside
like
the nose.
over here.
Your septum is in your left nostril.
I know, and it wasn't
Oh,
like that prior to
wow.
that surgery, though.
You can see
Right,
it.
so you
It's
gotta
like
definitely
pushed
fix that.
over into his nasal
The
cavity.
middle part of your nose here is very narrow and pinched. I need cartilage to put on both sides.
Rib.
We're gonna have to make a little incision right here, underneath your chest, and take a little small piece of rib.
Wow. Now that means I'll have a scar somewhere on my chest here?
Yeah, so you had a CT scan. Let's take a look at that. So
Okay.
here's that thing that's deviated, your septum.
Wow.
Oh my god, look at that. So we could see just cosmetically, right, from the surface that his nose is crooked AF. But look at that. It's shifted his septum. Your septum's supposed to be straight, right? You're supposed to have it go straight down in the middle of your face, and it's supposed to go in a straight line. The fact that his curves and goes right into his nostril nasal cavity over here, there's no wonder he can't breathe on this side of his freaking fracking face, because it's pinching off the airway, and his nostril is so itty bitty tiny right here that there's no way that not even this part, but then the pinched portion, the air has to come through with this almost closed off portion with how close his septum is to the side of his nasal cavity. There's no air coming in through this nostril, and he can only breathe through this side. This is a really crooked nose.
To the left here,
Yeah,
it's right here.
That's so crooked.
So if I push the septum towards the midline, you might feel better on the right. I'm gonna say about a 20% chance.
Okay. There's
Wow.
only a 20% chance of my headaches being fixed. I was hoping for like 90 to 100%, if anything. When it's all said and done, though, the headaches and the non-breathing, it's debilitating. It's gonna affect the rest of my life as a dad and a husband.
Yeah.
So if we can fix this giant problem, then sign me up. Sounds like you've got your work cut out for you, gentlemen. You ready for
Let's
it?
do it, yeah, we're ready for it.
If you're ready, I'm ready.
All right, so he's gonna have the surgery, but it's, again, always good to temper your patient's expectations to be more realistic. It will not guarantee a fix, but it could help.
For the doctor.
So it's still worth it to try.
Hey, finally, I'm here.
I love her crop
Just
top. Also, her
open my
boobs are
wallet
really
and just
pretty.
ask them if they
Cheryl's
can
boobs are super
make me
nice.
Chinese again.
Cheryl, how are you?
Wow, both of you are here. Wow, I don't know what to do.
So you
Both
gonna
of
do
your
that?
hands.
Terry Garone. Great top, by the
You
way.
actually,
Well, yeah,
Right, I agree. Her crop top's so
You're
cute.
dressed like Daisy Duke from the Dukes of Hazzard.
You're very pretty. Your face looks really good. What possibly could you want from us?
Are you kidding me? My face look. I don't know. Well, I don't know.
You had westernization of the upper eyelids.
Now I look like monkey's butt.
I do not agree.
The most popular plastic surgery procedure in most Asian cultures is conversion to a westernized or Americanized eye. It's theoretically, technically possible, maybe, to do a reversal, but until I examine her, I don't really know what the solution's going to be.
I mean,
I said, let's get the extra large. So might as well go big. That's what I figure, go big. Everything go big. So this way I figure, well, increases my chance of getting a boyfriend.
Okay, so
just
you had that surgery.
Getting laid. Yes.
So,
Yes.
you know the Asian eyelid typically goes up like this,
Yeah,
and
yeah,
the
yeah.
Western eye goes more at this level?
yeah, it's more
Do you think
horizontal.
yours goes too high or too low?
Well, my speculation is mine is too low.
Yours is too low. So yours is
So
too
you
far
wanna have
down
this
this way.
go up more.
You want it to go up more like this.
Correct.
Really? Have you had anything put in your cheeks? Filler, implant,
Yeah.
anything?
Maybe don't freaking prosecute me for this. I bought some black market, fillers from China. They were really cheap, and then
All right.
so I just stuck it in there, and then
You did that
You
yourself?
practice medicine on yourself.
well, do not quote me. Go shh, and release, and you're done.
That's not good.
I put in as much as whatever that $100 can buy me.
There's a lot of dangers with injecting yourself with some unknown product from China. You can get infected.
Oh, yeah, no. The fact that she's put fillers into her face, probably to fill in the fat deposits underneath her eyes that she got rid of in surgery, is really dangerous because you don't know what the hell you're getting. They could have sold you industrial grade silicone, like the things that they use on construction sites, or cement, and you've now put that into your face. They could have sold you really toxic chemicals that aren't good for your body that they just gave you for super cheap. You're not going to be getting, if you get anything, that is not a very well-known official filler that is meant specifically for the human body to go into specific parts of your face, because the things that you put in your face aren't necessarily going to be the same things you'd want to put into, like, your butt if you were doing butt injections or anything like that, right? So that is really dangerous because not only did it not give her what she wanted, and she has no idea what she's doing either. You don't know how much to put in. You don't know where to inject. You could accidentally hit a vein and completely cut off that vein and cause yourself to have a rupture. You could do so much damage. You could damage your nerves because you've actually hit and pinched a nerve instead. There's so many things that could go wrong for doing filler on yourself that you should never do it, and go to a professional who's going to do it for you instead. I get that you don't want the work to be expensive because you don't have a lot of money, but good work is not cheap. And cheap work is never good, especially when you try and cut corners and do it yourself.
You could have some horrible allergic reaction. It could actually hurt the blood supply to the area that was injected and
That
cause
too.
the skin to be black.
Why don't we
Necrosis.
go in the exam room and take a really close look at you, okay?
Put me out first. Give me lots of vodka first.
Oh my goodness.
Fair
Let's
enough.
go. Let's go take a peek.
Cheryl is out of her mind.
She has a lot of unrealistic expectations is the vibe I'm getting. I
Undo
really
the
like her
Americanization
personality
of her
though.
eyes.
Yes,
So you went
thank
from
you.
Chinese to American, now you want to go back to Chinese.
You ever heard the saying that the leopard cannot remove its spot? And that's me. If I'm a leopard,
You want your spots back.
well, I can because they took the stupid things out. So you gotta help me.
Close them. Okay, there's an incision all the way up here. And they can take out all the fat there. I mean, that's and our epicanthal fold is gone. I mean, you'd have to put fat right or a filler right inside
It'd have to be a
there
filler.
to cause that fullness and drop the whole area down and cover the eyelid.
Yeah, I mean, there's a special muscle in the eyelid called the levator muscle. Elevates the eyelid. We could, theoretically, detach it and reinsert it lower to give you that lower insertion point that Asian eyelids have.
Okay.
But here's the issue. It's hard to reverse that.
It is.
Close your eyes, close your eyes. Yeah, it would take very little to make it so you could never close your eyes again.
Which
What do
is
you mean very
worse.
little?
Any little bit of
understand.
swelling or scarring after any further eyelid surgery, you would never be able to close your eyes again.
Are you trying to scare me? Me will
I'm
be
telling
like
you the
that?
truth. You'd sleep with your eyes open, you'd always have irritated eyes.
I'll take the chance. I will sign the waiver, whatever.
I
It
don't
just
think
doesn't work that way.
it's not worth it.
$100.
That's also not worth it.
$550 maybe.
Oh,
No,
$550.
we specialize in is fixing disfigured or botched surgery. Yours is not botched. Yours is
Yeah, hers was actually done
She should
really
leave
well.
well enough alone because she can get into big trouble.
You broke my heart.
Sorry. But safety first.
I guess I can't argue with that.
Yeah,
Have a nice day.
Well, that's
That's
not
true.
what I wanted, you know.
I know.
But yeah,
Oh,
anyway,
she's
you
super
guys
cute
go.
though. I love her
He
outfit.
might be, but I'll talk to him about it.
Oh, okay. What do you do? Bye.
Bye. Really?
Oh, that was unfortunate for her. But rather than surgery, if she went to an actual filler practitioner, because not everything that you want to do cosmetically has to be solved with plastic surgery. Sometimes you can do non-surgical solutions, right? You could do, if you wanted thinner things, but you wanted no surgery, you could always do cool sculpting. There's a lot of different options for her specifically. She took out her fat deposits on the upper eyelids and on the lower eyelid. So if she went to an actual filler professional, then she could have them reinsert filler specifically underneath and on top of her eyes to the quantity to recreate the anatomy that would naturally be there from the extra fat that exists for most Asians, their eyes. So that could be something that she could do that's non-surgical, that wouldn't cost nearly as much money, and not have the risk of making it so she could never close her eyes again, because that would cause even more problems for her in her life than what she wants cosmetically fixed right now. You don't want to trade something that looks good for something that's going to make the quality of your life physically worse. It's just not worth it.
I just don't think she's a candidate for a haircut. You should date her. I could see that happening.
But it's okay. I'm fine that way.
You dated crazier girls than that.
No, I haven't.
No, I haven't. Jesus Christ. She has a really good personality. I don't like that they made fun of her.
Thank you.
Like, she's very strong personality-wise, but
This is an extremely new experience for me. I've had
I like it.
surgeries done in the past, but not quite as sober as I am today. And thanks for taking your day off from work.
Where else would I be?
The races,
This lady was you.
the races.
the strip clubs.
Janice?
Hi.
Hi, my name is Ozzy. I'm going to be your nurse
Hi, Ozzy.
today.
How are you?
Good,
Good.
how are you?
Awesome.
I can take you back.
Thank you.
You'll be fine.
I know.
We're going to take good care of you.
I
Come on
know.
back.
Thank you. Bye, Rocky.
Oh.
Wow.
Ooh, I like the man's shoes.
I'm
The
a little
the
scared.
friend's
It's an
shoes
enormous
with all
challenge
those
to manage
metal
someone
spikes.
post-operative
Whoop,
pain
those were
who has a
pretty.
history of narcotic addiction. So we may be in for a real wild ride with her.
Can I please have some Valium right now?
No.
I'm nervous. I'm nervous. I'm nervous. I'm nervous.
You have to watch her very closely because she will either be very resistant to pain medication and want a lot more, or she won't want to take any at all and will be in a great deal of pain.
The
Which
question
is
are these
a
ruptured?
problem
I
in
don't know.
either regard. You
Well,
don't
she
want to
has
have
a
to
little
deal with
mass
either
there.
of those.
So, possible breast biopsy, right breast.
It's the edamame.
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 Do something to my vag.
Or
I
not,
like
no.
Janice, but she's a challenging patient for many reasons. She doesn't give you exactly an accurate history. The other challenge will be managing her postoperative pain.
Anything you feel like having? Cocktail?
I mean, I know she was just...
Hey, of course I don't want a cocktail. I'm anxious. I'm nervous. I don't really know what to expect about the breast pain that I may be feeling. And I'm an addict. Anything that isn't doctor prescribed, that's when addiction kicks in. Do it.
All right. Start thinking of a nice place to go on a little vacation.
Yep, they're gonna put her under, but I mean, I know she was just, like, joking, because she's like, oh, I'm already gonna be out, just do something to my veg, but, like, a breast surgeon should not be doing the same cosmetic procedure as, like, a labiaplasty or whatever kind of surgery she would want on her vagina if she was going to get one done. You would want to go to somebody who specializes in labiaplasties and is knowing exactly what they're doing with that, because technically any plastic surgeon can do any plastic surgery procedure, but you don't want to go to just a general plastic surgeon for what you want. You want to go to somebody who specializes in exactly what you're trying to do. If you want to have facial surgery, you want to go to somebody that specializes in that. If you want to have breast surgery, you want to have somebody who has a really good book of work for breasts. Same with BBLs, things like that. If you want a labiaplasty, like she was talking about, or something else for vagina surgery, you can do that too. If you wanted penis surgery of some kind, then you want to do your research and find somebody who's really good at doing specifically penis surgeries, because you don't want to just go to somebody that's like, yeah, I'm a cosmetic surgeon and I'm a plastic surgeon, I can just do it all, because a jack of all trades when it comes to plastic surgery is not the tea.
Happy thoughts.
For Janice's surgery, we're first going to remove her old implants.
Yep.
Then we'll remove the masses from the right breast for further testing, and I'll finish by putting in 2 new implants under the muscle.
There you go.
Okay, so first thing we're going to do is go ahead and make an incision in the right
Okay, you guys aren't going to be able to see a lot of this. It's going to get blurred because we're not allowed to show blood or anything like that on YouTube, so you'll kind of see shapes, but nothing crazy. You can't see the implants coming out or anything like that.
It's so old
But
that all the
it's completely intact.
Completely
intact.
And they were
Was
a
not
little bit
ruptured.
gooey, which is evidence of a micro rupture.
But they were micro rupturing. That's not good.
Once I got inside, I could feel those masses better, and they were quite large, and they need to come out. There's another one.
They're
So here are
probably
2 little
like
breast masses we found.
Wow, those are
One is in large
interestingly
lymph node
shaped.
for sure. The
Again, I
function
can't
of
show
the
you
lymph
this,
nodes
but
is to do surveillance and to remove toxins and cancers and bad things. You don't want to clog them up.
Yep.
So we need to send this off to pathology and see if there's anything that we need to worry about. There could be
or if it's just
a number of things
weird,
here, including breast cancer.
you know, little polyps that were formed inside her to
This is
protect
the
her
part
from the
that's gonna give her all
silicone
the postoperative
that
pain.
was starting to
So
come
I'm
out of her
gonna do
implants.
Janice and myself a favor and numb her up with a lot of long-acting numbing medicine to try to keep her as pain-free as possible post-op.
Very
Not
smart.
gonna come off. Because of the inflammation, the muscles were very tight surrounding the implants. So I need to do a careful release to allow them to look like normal breasts and for them to be comfortable in there. Okay, so we're putting in a new pair of implants.
Okay.
That are not decades old, that are of a thicker generation of silicone envelope and have a little more projection to them. A similar
That sounds
sized
like it'd be a
implant compared to
great
what you had before.
solution for what she's wanting.
That muscle feels really tight.
That looks like a really good breast
The other
shape.
one. We have the other one.
Like that's a really good mound and projection. The
So I'm going
projection
to
she has
close
is
off
great.
the old pocket to prevent the implants from popping back into the on top of the muscle position and
Yep,
keep them
you want to
under the
sew it
muscle.
down.
All right, let's sit her up.
You don't want them to go whoop right in the middle.
So are there any improvements at all we can make at this point?
They look really good.
Actually, they're pretty good. Let's put her down.
And there's no rippling
Let's close her.
I'm scared of
as well.
recovery.
Oh, man.
It looks
I love
great
Janice.
under the
Janice is
muscle.
the
Looks
greatest
very
patient
full
when she's
and
in a
more
chemical coma. What I'm
youthful
concerned about
without
once
any
she wakes
ripples.
up, are we going to meet the happy-go-lucky Janice? Are we going to meet the ex-addict Janice?
Probably the ex-addict.
I have no idea.
Because she's going to be in pain, and her first response is going to be going back into old habits and popping more pills than she should, most likely.
Morning, Melody.
Good morning, Paul. Hi. Ready for surgery?
I'm ready.
Great.
I'm going into the same surgery
His
that I went
nose is
for
so
years
bad.
ago that did not end well, and wondering if, in fact, this might be the same or even a bigger mistake.
Your surgery is what?
I don't think it would be a bigger mistake.
Probably gonna head out right now in a few. I really wish I could be here with Paul all day, but unfortunately I have a doctor's appointment. We're looking to see that the doctor can tell us if it's a boy or a girl, so I am planning to give Paul the good news today. I'll be back around 2:33.
Okay. Wanting to know if it's a boy or girl is totally getting me through the whole day today. If I could hit
Aw.
a fast forward button right now, it totally would. I love you so much. I'll see you soon.
It's been stressful. My
I love
biggest
her
fear at
shawl.
this
That's so
point is
cute.
that he's gonna suffer, you know, and I don't want him to feel that way. I want him to know that I will be at his beck and call.
She is a really supportive partner, and we stand that. We stand! Ooh, cars, LA. Ooh, fancy rich people.
Baby tiny needle, okay?
Wow. Look how ripped I am.
Jesus. I wonder why Dr. Dubrow is helping Dr. Nassif with this nasal surgery.
We have several goals for Paul Levin's nose. We're going to use a piece of rib to straighten his nose and make his tip
Okay.
symmetric. We'll get rid of the bump and improve his airway, which will hopefully help improve his headaches. We're
That would
starting
be
the rib
great.
harvest now. Okay, let's have some retractors. We're now removing the rib from the chest wall.
Ah, he's getting the
And
rib
here's
for
what it
him
looks
so
like.
Dr.
Anytime that
Nassif
you're
can focus
lifting
on
up
just
rib
the
from chest
nose.
wall, you have to be very careful because if you're not, you can get right into the lung space. And this
Yeah.
is what's going to help me rebuild the middle part of his nose. and
Again,
keep
we
his
can't show
septum
you any
straight.
of this,
Terry, now
but
let's open
he
up the
pulled
nose.
out a piece of rib,
Do it.
cut it up with,
We're opening up Paul's nose. Ooh, he's got, oh. How do we miss this? He's got a large synechia in the right nostril. You know,
The
that's a scar
synechia.
band between his nasal septum and the side of his nose. That could be one of the reasons why he's having a hard time breathing. Maybe
That
after
would
we
be
cut
do it
that
too.
Scar, his headaches might get a lot better. When you do a rhinoplasty, your goal is to leave a good amount of support left in the nasal septum.
Right.
So we're going to take a piece of rib. This will help make the nose look more straight.
Give it the structure it
Everything
needs.
that I'm doing will also make his airway better.
Good.
I used rib cartilage almost everywhere in Paul's nose.
Wow.
It's a rib nose.
It's a rib
When I look at his
nose,
nasal
completely
bones,
redone
the upper
nose.
half of the nose is still
Wow,
crooked.
that's so much
And
better.
The best way for us to help straighten out his nose at this point is to refracture the nasal bones. Tap, tap.
Yeah. Again, I
Look at
can't
that
show you
shape of
guys.
that.
It's very
God,
bloody.
that's pretty.
But
All right,
basically,
guys.
what he did is, and it looked kind of intense because it is a little bit intense, but when he was saying to refracture the nose, they take a metal rod, they put it in your nose and put it on the exact spot that they want to fracture, and then they take a mallet and they smack the metal rod into the exact spot in the nose to fracture it, to break the bone, so that they can now move the mobile broken pieces into the exact shape they want, so that when it recovers and scar tissue forms to, you know, take over and help heal that part of the nose that they fractured, it will be in the exact shape in the mold that they've created, rather than allowing it to just continue to exist in whatever, you know, wonky, crooked, fucked up way that it was originally. His nose is very bloody, but they're much larger. His septum is way straighter. It's a little wide, but I think that's also from the swelling of also them just fucking hammering and smashing everything into his nose. So that part should also go down, but I think he's going to be really happy not only with the cosmetics of this, but the fact he was able to cut the scar tissue that was inside, remove the septum that was basically occluding the entire left area of his nasal cavity is going to be so good for his breathing.
Everything looks great. Why don't you put on his cast, Dr. Davia, and I'll see you guys in the recovery room.
That looks way better.
I feel very confident that he's going to get a great result. Here he is.
Ooh.
Mr. Paul Levin.
Glory.
Hi.
And we have Cecilia with us.
Baby. Have any news for me, baby girl?
Yes. He thinks that we are Team Blue.
Which
No
means
way.
what?
No way. He thinks we're having a boy?
Uh-huh.
Seriously?
Uh-huh.
After Nassif or naming our boy after you?
I think that's
Paul.
a great name. Paul is a fantastic name.
Absolutely.
I would really be flattered if his name wasn't Paul.
If his name wasn't Paul, that's the post-anesthesia
I'm so excited.
talking.
No, so awesome.
Well, congratulations, you two.
Thank you. I know it was a really busy day. You
I would
had a busier
totally
day,
make out
obviously.
with you right now,
Well,
baby.
I'll tell you, why don't I let you two do that then?
Oh, God, thank you.
Thank you so much, Dr. Nassif.
And I'll see you tomorrow.
Nice
He has a
meeting you.
great
My pleasure.
personality
You guys
after
must have support my younger baby.
anesthesia.
Yes, I mean, this is like a
He's in a
different
great
world this
mood.
time.
You think I look handsome like this?
Mm-hmm.
You all about this? Wanna get on it? There's room for two on
Oh,
the bed.
snap.
There's room for two on this bed. He's funny. He's really jovial after surgery, which is rare.
Look at you. You look amazing. Just one day out of surgery, you look incredible.
I hear what you're saying.
Her lipstick looks
but
great.
It's not computing.
How are you?
She looks
I feel that I
terrible.
should have been left longer at the recovery place.
Where's your dress? Who took your dressing off?
I did.
What is this?
The drain from my boobs.
You took your drain out? Kill me.
She took her drain out. I completely forgot that she did that. Oh my god. Okay, so when you guys have surgery, for those of you who don't know, there are some times that you will have drains. Not like for my breast surgery, I didn't have one, but that's still pretty common because there's a lot of swelling, there's a lot of fluid that gets built up in the area, and it allows for that fluid to drain, thus the name drain, out of your breast pockets into the drain, right? And keep the swelling down so that it's not as bad, especially if it's a very intense surgery like Janice had, where they were sewing down the chest wall and removing scar tissue and reshaping the pocket and tearing up the muscle and putting stuff under and re-sewing, like it was a lot, right? So she needed to have drain because there was so much more going on than just a regular replace implant on top of the muscle, boom, done kind of surgery, right? That wouldn't necessarily require a drain. But you never take it out because now she has an open incision in her breast. There's just an open hole. That means that there could be any kind of bacteria and infections that get into that because she's now created an open space to the inside of her boobs that is able to have any sort of horrible things go down and happen. So that is terrible. And she took off her dressing. You're supposed to keep your dressing on so that if there's any kind of issues that the doctor can carefully peel them off so you're not ripping the dressings off of yourself and hurting yourself and fucking up the results immediately afterwards because you just ripped it off too soon, and they may need the support that the dressing is going to provide too. There's so much that she did wrong here. Holy shit.
This is so dangerous, Janice.
Yes, it is!
Well, I'm sorry, so sue me.
Jesus Christ.
Sue you,
All
but-
right, it's not about you.
Well, the problem
Wow.
is this is a sterile thing that goes inside.
So it's still sterile.
No, it's not.
This is, Once you disconnect the tube from the bulb, you contaminated the entire thing, and bacteria can crawl up the tube into your breast pocket and cause an infection.
Yes!
Did I up?
Yes!
I've never had a patient do this before. Are you trying to have a disaster on me? Don't do that.
No.
Look at all that fluid. Well, you cut the stitch here, and see, now you're bleeding over here. You're doing things that could turn into a big problem.
Oh, wow.
To take it off.
Right, that's true.
That's
I also
because
didn't
it's
tell you,
fucking
not to jump out of
common
an airplane.
sense
You're
not to
gonna
do it,
that either,
Janice, you
right?
fucking idiot.
All right, enough.
In my 25 years of being a board-certified plastic surgeon, Janice is by far the most difficult patient I've ever had. She is her breast's worst enemy.
Oh,
I'm gonna
100%.
wrap you up so that no matter what you do, you can't touch these incisions anymore.
It's not the incisions I did it on. I did it on.
You just touched the incisions in front of me.
What, those?
Yeah, those.
Yeah, stop touching
If
those.
you would give me something for the pain, doctor, please.
You just spent 3 days in the hospital on IV Dilaudid. Most people are on aspirin by this point.
I don't give a about most people. That's nice for them.
That's the
You
addict
have to
coming
give me
out.
Something. I'm serious. I don't want to feel this bad.
The ex-addict is coming
Oh,
out.
100%.
We've got postoperative
She's, like,
pain management
begging
problems.
for
I'm
pain
kind of at a
meds.
loss how to deal with her right now.
It hurts to blow my nose. It hurts to take a. I'm
We
in a
don't
lot of
care.
agony.
You're
So
just
I
gonna
want
have to
be
deal with it.
prescribed For 2 or 3 days, the same that I had at the hospital.
This is classic drug-seeking
It is
behavior.
very
So let me tell you
drug-seeking
why
behavior.
This one hurts more than that one. You know you had those masses up here.
The
Mass.
edamame.
I took one of them out. It was like a calcification.
Angela, she
like
says
the
it
type
right
you have
now.
when you have breast cancer, but it wasn't a breast cancer. It will not be a breast cancer. It's just a reaction to the little micro rupture of the silicone, okay? Thankfully, they're benign. They needed to come out, but they're benign.
Thank God.
It's all gone. So,
Thank you.
So I have brought you a fresh bra that I'm going to put you in.
Is it black?
Black surgical bras?
Yeah.
No. This isn't the Victoria's Secret's
Mine was
lingerie
black,
catalog.
but-
This is recovery. Get it together.
It really
Right,
doesn't
are you gonna
matter.
go out?
Yeah, I have to work.
You're going out tonight?
Of course.
With drains in place?
Yeah, she needs to be seen. She needs to show
Seen
off
with
her-
drains and narcotics on board? You had breast tumor excision. You had
Blah,
4.5 hours of reconstructive surgery. Can I talk turkey with you for a second? Can I be
Yeah,
a little,
you can be
can I be a
real,
little
just be
brutal?
real.
Can I be a little brutal? You're gonna this up.
Yeah, you
If
are.
You keep acting like this, you're gonna it up. You're gonna get a complication and you're gonna lose both breast implants. I'm not kidding.
The fact that she wants to go out the day after surgery, or 3 days after surgery, like the week of surgery, post-op, and be a normal person, like, oh, I'm going to the clubs, I'm gonna go partying, I'm gonna do, appearances for magazines or whatever the it is that she's going to be doing and socializing with. She should not be doing that. If she wants her breasts to turn out with the most optimal results, you need to give your body the time to recover and say no to events and socializing, because you need to recover. You can't rip your fucking things out. You can't be touching your open incisions that are still healing because you could cause an infection. You can't be having holes in your boobs because you've taken out the drains that could again cause an infection. And she's just trying to seek drugs with the ex-addict part of it coming out, just like he was saying before. Like, she is being extremely, extremely, extremely difficult. If she turns out with a good breast result, I'm gonna be shocked.
This up. If you keep acting like this, you're gonna it up. You're gonna get a complication and you're gonna lose both breast implants. I'm not kidding. I need Janice to have a come to Jesus moment and realize she is dangerous to herself and her breasts.
Yep.
Don't take this question wrong. But why do you smell like cigarettes?
Well, Steven smokes.
It's me, yes, I smoked.
Have you been smoking?
I have not been smoking.
Has she been smoking?
No, she has not.
Why do you say it like that? Did
Today.
you smoke a cigarette today?
Do you smoke, Janice? 'Cause I didn't see you smoking.
Did you smoke a cigarette today? You did smoke a cigarette today.
Okay, so she did
All of these
smoke
things
as
could
well.
lead to a
Oh my
serious
God.
infection, which could land her in the intensive care unit, require emergency surgery, and be honest with you, could kill her. Right now, I've got you in a great spot anatomically.
I'm so happy.
Just wait. This is the worst they're gonna look.
I just have to tell you the pain I'm in right now, so you can get out your little whippersnapper.
All right.
Script pad.
She has Percocet at home and Valium.
Yes.
Yes?
That's more than
Yes,
enough.
Yes, I need to take one now.
I physically don't have any.
Okay.
I'm not a pharmacy. I don't carry pain pills with me.
Yeah.
That's not what doctors do.
Could you go to the gym?
No, she can't go
What?
to the
Oh, I
gym.
can't pull my pants up. I'm sorry.
No, you can't go to a club or a gym or the beach or Hawaii. Go home.
Okay.
Be normal.
How the am I going to hide these drains?
You don't need to hide the drains. You need to, oh my god, you need to go home and rest and deal with the drains and leave them on until it is time to safely take them off so you can have the result you want from the breast surgery. You can't just have surgery and immediately go back to your normal life the fucking week of. That's not realistic. She has completely unrealistic expectations of where she should be with the results she should have. She wants shit immediately. She wants instant gratification, and she doesn't give a shit about anybody else. And that is going to be the downfall of her surgery here. And she's already smoking cigarettes. You're not supposed to smoke after surgery, even if you are somebody who's normally a smoker, because it makes your body not heal as quickly and recover from surgery as well. So it makes your chance of infection higher. It slows down your recovery process, makes you go backwards in progressing after surgery to the results you want. That's why you should never smoke after surgery.
You're not going
Never
anywhere,
smoke
Janice.
nicotine.
I have two major fears with Janice. One, that her narcotic use is going to be out of control
That
and she's
too.
going to be found dead in her bed. And two, she's going to contaminate her wound so much that she develops a breast implant infection. I have to take them out in the middle of the night, and she's weirdly going to blame me for it.
Yeah. Her leggings are cute, though. Doesn't excuse her behavior, but she has cute leggings.
How you feeling?
All in all, pretty good. A little sore in the rib, but I'm all right.
There is a chance that this surgery can fix the headaches that he was having, but it's still an unknown. You have a
It's true.
little bit of some greenish stuff
Yeah,
there.
you guys
I'm
aren't going to
looking
be
at,
able to
but
see
that's
him
probably
pulling these out,
Here they come.
because we
They
can't
come
show
in.
that.
Okay, wow.
There you go.
Okay. Those are way longer than I thought they were.
Now, next step is to take off the cast.
Okay, all right. This is it. The first time my cast came off, the surgeon looked at me and actually was like, huh. And now that today is the day that I'm getting my cast off again, I really am just gonna be staring at Dr. Nassif. I hope that they just smile and tell me that everything looks great.
You ready? The cast is gonna come off in a second. All right, let me look. On your mark, get set, and go.
Wow, that looks so
is
much
crazy.
straighter.
It's symmetrical.
It's so
Your
straight.
Looks like my tip.
Hey, we're tip brothers. Thanks to Dr. Nassif, I really am able to now
Wow.
be the dad that I've wanted to be. I haven't had a single migraine. It's amazing. Before my surgery, I had a crooked nose. I had two
Yeah, he had two small bumps of that. Look at that. You can see that his septum is not only is this part between the nostrils that separates your two nostrils not straight on this side, but it's going right over here and completely cutting off his left nasal cavity, right? That's so small. On this side, you can see if he goes up, we'll get a better look. But you can see that it's not going in there. It seems like there's an even amount of tissue on both sides to have the nostrils be symmetric, and you see here that it's also going crooked over here to his left side, whereas this one is going more straight down the middle and is a more even distance between his eyes, which he has beautiful blue brown eyes, by the way.
two small bumps on the bridge of my nose, and I couldn't breathe out on my right side. And now I have
Wow, look at that. Yeah, you can see the one bump that he has here and another one that's right here, and this one is just a beautiful slope, just straight down. That is such a good result. It's so smooth. He was able to shave that down completely, so there's no bumps at all. Wow.
I have a straight nose, no bumps on the bridge at all, and I can breathe out of both sides.
And he
I'm
can breathe
loving
out of both
every day that I
sides.
get to spend with my family now. I'm so happy. I'm on cloud 9. I'm so grateful. You have no idea. Thank you so much.
Our pleasure.
Good for him. Oh god, this is now day 7, 1 week after surgery.
How are you?
I have no recollection of last week at all.
Nothing.
Look, whatever I said, however I behaved, I'm very sorry. It's not me, it was the meds. It just was the meds. I'm sorry, it was the meds. I didn't know if I broke my sobriety.
That doesn't count.
It doesn't count because I was under doctor's orders.
No, you had surgery. I mean,
Yeah.
you went through a lot. That was a big
We went
week.
through a lot.
We went through a lot.
What did we do?
You were a little bit...
Discombobulated.
That's a good word.
That is a good
I'll go
word.
with that.
Were you breastfed as a child?
You know what? I wasn't breastfed.
See,
Maybe that's why...
you're fascinated with my... I knew it.
Well, you know when
Jesus.
you're just coming into your own as a kid?
Yeah.
All I saw were breasts.
Where?
Everywhere. Every girl is just
You
breast,
just
breast,
were
breast. I'm
like-
just like a breast freak. So
You were really,
I became
really,
breastfed.
did you
There you go.
Not bad.
Get over
Those
here,
actually
big guy.
look
You know what's cool? You
oh,
had some
really
redness
good.
at the end of the procedure, and it got worse over the next few days just because of all the surgery I did. It's gone. You are surviving your discombobulateness.
I have a great doctor. You completely fixed a botched
Her
surgery.
Yeah, no, it's good.
entire mound looks really good.
When was the last time you looked this good?
Seriously.
Since my ex-mother-in-law fell in the well.
All right.
I will rock
All right.
these.
All right, my sweetie.
Wow, those look really, really good. 6 weeks later!
Today's a
Holy
really
shit.
big day for me. I'm shooting my own campaign for a new skincare that I'm launching called The Answer.
I'm so excited. I'm gonna go get her and see what she means. Well, so you can see for yourself, yeah?
Okay, so she's doing an
Great
ad
to have
for
recovered out of this whole
skincare
experience with
campaign.
Dr. Terry Dubrow, to be back on my feet, looking better than ever, feeling better than ever, back on the bike again.
Ooh, beautiful white dress. I would die in those skinny stilettos. I have to have wedges or thick heels. I cannot walk in stilettos or I will die. Damn, look at her boobs! Oh my god, they look so good! I am shocked that they turned out well.
Before the surgery, my breasts
Wow! Look at the difference. So you can see that this one was lower and bigger than this one. This one was far shorter than the other one. This one over here now, they're symmetric. They're the same shape. There's no more rippling because it's under the muscle, so it has both muscle and skin to move out from to give it a more natural look. So that is amazing, and it looks so much better than it did in the prior one. Plus, these were 30 years old and could have caused a lot of really bad health complications to her in addition. Holy shit, her first week was just very going back to bad habits, addiction, and she noticed that and saw that. Her excuse of it was the meds, it wasn't me. There's a little bit of truth to that because if you give an addict a trigger, then they will fall back much more easily into their addictive behavior, like she was doing, where she was trying to seek more drugs, get as many drugs as she possibly could, get all the pain pills, get everything, right? And then after she was able to kind of wean off of them and go back to normal, she was in a more regular state of mind and was not in as much pain and was like, okay, now I can think more sober thoughts and realize that what I was doing before was not right, was not what I was supposed to be doing. So that's I'm glad that she recognized that because it's it does have to be hard from her perspective. No, they look great. Wow, those look so good. I want to have like really good.
I'll be going to the beach.
Like that was a really good
bikinis I can get my
cosmetic result for her. I would want mine to be higher though.
Take pictures of them and try to find fault in them. I can't wait to get on a pogo stick naked and just bounce up and down.
Those look really good.
Look great. Should we do a nude?
Yeah, she looks amazing. So with that episode, we saw a breast surgery. We saw a westernization of the eyelids that wasn't going to be corrected because any other surgery would have caused more potential harm to her than it would have caused good. And the things that she wants, she probably could have gotten a filler done with to really make that the look that she was going for trying to revert it back to a more Asian eye aesthetic. That's something that she doesn't necessarily need surgery for to get corrected, and I hope that she ended up going to a filler practitioner instead for that. However, the result that we had on the nose surgery was so good. His airway was larger and he was able to take in more air. His cosmetically septum was straight. There was no more bumps on the bridge of his nose. It looked fantastic. And then despite Janice having a terrible first week, she actually came out with them being really good on top. She's very, very, very lucky that after taking out her sterile drains, undoing her dressing, touching her open incisions, and basically doing everything wrong she possibly could in the very first week of surgery, that she did not have an infection or a complication. She is extremely, extremely lucky that that did not occur for her, or at least what we were able to see on the show, which I would hope that if there was a complication, they would have said it and shown us, but you know, there's only so much the magic of editing can show us and tell us the narrative that they want us to see. But it did turn out really good in the end for her, which is really nice. And now those implants will be able to stay in, and she'll be good for another like 10 years or so before she has to get them replaced again, or just get them taken out, whatever she wants to do 10 years down the line when she gets to that point in her life. But that's going to be it for today's episode of Botched. If you guys enjoyed the episode, make sure you go ahead and lick that like button and subscribe, because not only does it taste delicious, but it helps us with the algorithm and growth on the channel tremendously. And make sure that you do not miss out on any future episodes that we post here in the future, since I will be posting weekly here to the channel. So, without taking up any more of y'all's time, I will go ahead and let people go. Goodbye, my lovelies.